So, hello, this is Dr. Sean with the PT's PT podcast. Today, I've got a special guest, Dr. Marisa, who's a PT here at Concierge, and all of her details and info will be in the bio. But today, we're here to learn about her journey as a physical therapist, and maybe to talk a little bit about her interest and her specialty in running. So, without further ado, here is Dr. Marisa.
Hi, I'm Dr. Marisa.
So, this is our first time doing this together in the same room. So tell us a little bit about why you became a PT and what you love most about being a PT for runners.
So I always knew I wanted to get into healthcare. I didn't know exactly what avenue. And then I tore my ACL my junior year of high school and got to spend about 6 months in a physical therapy clinic. Really enjoyed my PT. And then that's when I kind of knew that I wanted to go into physical therapy.
Yeah. And tell everybody your background. So you got an athletic training
So
background.
yes, so I'm also an athletic trainer. So I did the 7-year program at Springfield College where I got my athletic training degree and I'm certified in that as well as my PT degree. So I do athletic training on the side locally, kind of a lot of high schools, a lot of Worcester coverage.
Yeah. As a clinician, what body parts and what diagnoses excite you the most?
A lot of my athletes excite me, but kind of anyone who comes in with a challenge that makes me think. So it might not necessarily be like a specific body part, but I have a few right now who it's like they always make you think, like they're never going to come in the same way, or thinking about how like their low back's related to their ankle and the ankle's related to the opposite hip, even though you're treating their right hip. It just keeps it exciting and you like never know what the groove's going to be for the day.
Yeah. What's something you say, that you've learned in the past few years that you wish you knew when you first graduated?
Oh. That you're always going to have time for like more testing, more diagnosis. You don't need to know everything day one. Like I think sometimes getting to know people more and getting that like personal side, that empathy, you're going to learn a lot more about the patient and what they're feeling than just like your day-to-day tests.
Yeah.
And you always have time. Like you're not going to know everything day one.
Yeah. So you open up a book and, you know, the information is out there, but
Yes.
you've got to find it too,
Yeah.
Tell our audience a little bit about your history with marathons
Yeah.
and your specialty with runners.
So I started running my junior year of college. I put it on my bucket list to run a half marathon and then just signed up for one day and decided to do it. And then I've run 2 more half marathons since. And in October of 21 or 22, I decided, okay, like marathon's the next journey. So then this January, I just ran my first marathon down at Disney. Highly recommend Disney. It's a lot of fun. But it was just like something that I always wanted to do and realized how passionate I am about running and like ideally want to work more with runners because it's a passion I share with them.
Yeah, that's great. So we've got an Alter G treadmill here and a shockwave machine. How is that, if at all, changed your practice in treating runners and lower body injuries?
The Alter G definitely has come in handy with, I was treating a cross country runner and we were trying to get in before like preseason of they needed to keep their miles up, but we didn't really have like time to tell him to stop. So we were able to put him on the Alter G. He would come in early, run his 2 miles at like a 70% body weight. So he wasn't feeling the same pain that he was having, but he was able to get as many miles in that he needed.
Yeah, that's using the Alter G.
Yeah, and then
Yeah.
the Shockwave too, definitely a lot of people who have really tight calves, as well as like plantar fasciitis. I've seen a lot of success with using the Shockwave. I had someone who their calf tightness was like so tight. I tried Graston, tried beating it up, nothing would get it to go, and the Shockwave really helped. And then right now working with an athlete and their plantar fasciitis, it's kind of the only thing that's keeping it at bay as we're trying to just get them through the season. And then we're planning like more rehab after we get them through their competition season.
Nice. That's great. What else do I got here? What do you love most about being a PT?
Getting to work with people every day. Like you never know what's going to happen in the day. You never know who's going to kind of come in the door and what impact you're going to make on them, both like health wise, but I think something I didn't learn in school is how much you can impact just someone's day-to-day life, both like from a physical therapy standpoint, but also just like being a person and helping them like just either smile more or have a better day and just kind of be there for them.
Yeah, yeah, I think that's great. Which ties in nicely to what advice would you give your younger self?
Oh, it's okay to ask questions. You're going to come across patients who just their symptoms, what they're feeling, what you're seeing isn't going to make sense. So always ask questions. And you have time. You don't need to know everything on day one. Like you can find out more about them as you go, and you just need to take the time with them.
Yeah. What qualities do you feel like makes a great physical therapist?
Good listening, good empathy. Like all of the hands-on skills, like you can learn those, but the personality of the person, I think, is one of the biggest things of being able to turn it on when you have a certain patient of like meeting their energy, but then knowing when you have to like back off and kind of meet their lower energy and figuring out what people need day to day. Because like the skills are there. It's like the personality piece that is definitely like really important.
Yeah, like one of the things that I always say is like, when you've got when you got a patient and like you make that connection and you establish that trust, it's so much easier to get them an outcome
Yeah.
because like they trust you,
Yeah.
and I think that that's, as a new grad, like I wish I knew that more and spent more time, and I feel like I've always kind of had that a little
Yeah.
bit, but like, n knowing that like you're not going to have all the answers
Yeah.
is just part of the ball game. And I think it's great that you talked about that because as long as you can develop a rapport and just say like, hey, we're in this journey together, like that's like half the battle.
Yeah, and that's the biggest thing. I've had so many people since I've started here almost 2 years ago that are still here and we're treating them for something else because we were able to like build that rapport in the beginning. And one may joke that we didn't have all the answers in the beginning and it was a challenging at first, but now they're back for another thing and they like trust us completely here. And it's been a really cool to like build that connection and see their journey of like just getting better and things that they never thought would actually change.
Yeah, I think that's awesome. And that's, part of the reason why we became PTs in the first place, right? Is to see them through that journey. And Con Ed. So let's talk about Con Ed. So that's typically something that comes up, from newer grads is like, hey, what's your budget at concierge for Con Ed? And, I always like to ask any of our guests or, what have you taken? What do you like? And, you know, talk about like, maybe the best Con Ed course you've ever taken.
So my big thing like coming out of school was I knew I wanted to like build my toolbox, that like I wanted to learn as many different things, not to have to use on every single patient, but to know when to pull those different things out. So I'd have to say so far my favorite has definitely been the dry needling course. I think it made me rethink about a lot of things that I kind of had forgotten during school, like really kind of dive back into the anatomy, even like the neuro side of things that I wasn't thinking about. And it definitely has changed some of like my practicing of using the dry needling.
Awesome. How do you feel like that has shaped your practice with runners?
Definitely using it and realizing how tight runners are and using it of like getting those muscles to relax. A lot of them need it in their like calves or Achilles tendon, just creating better mobility. Is the big thing with the dry needling, specifically for runners. Like we're using it more to get the muscles to relax so they can move through more range of motion. Personally, I had my Achilles tendons dry needled and realized how tight I was, and then how much better running felt after.
Yeah, I mean, it really just releases the nervous system because the nervous system kind of just gets yipped up.
Yeah,
And it's great. I think it's tough as new grads and as PTs is, we can't, and I talk about this, like you can't qualify muscle quality,
no,
right? Like there's no objective score for like there's a bunch of trigger points other than like tenderness to palpation. And, until like ultrasound technology gets better and all that, like there are a lot of like, sarcomeres that aren't in series. And like that's honestly the trigger of pain, and
yeah,
I think when you add tools like dry needling and Graston and Shockwave and whatever other instrument assisted soft tissue tools they've got out there, it can really help you, add muscle length to otherwise tenacious muscle groups. And, I think not to like get too far into the weeds on it, but
Mhm.
like hamstrings, like the perfect
Yes.
example are hamstrings. So like somebody can have a hamstring 90/90 that's zero, but then you go touch their hamstrings and it's like they're like piano strings. So like that's a muscle quality issue, right? Their muscle length is fine, but their muscle quality is all like it's just
Yeah,
all trigger,
like
trigger
I
points.
had a marathon runner who definitely quality of the muscle, like they could move through, but definitely like the quality was they needed some help there.
Yeah. Um, Great. Going back to my cues here. This has been good. What's next for you? Next 3 to 5 years. What's next for
Just keep
Marisa?
learning. That's like I realized being out almost 3 years now, like you're gonna learn, like I'm learning a lot, I'm seeing patterns more, but it's realizing that like you aren't gonna see everything in 3 years and just to keep learning, be open to new ideas. Definitely interested in expanding like that toolbox of working on like spinal manip courses. Um, Kind of intrigued by vestibular as well, of just like expanding how I can help and continuing to grow. Like I think I'm still early on in my career and there's a lot to learn and a lot to grow. So like kind of just working on that of expanding what I can do as a physical therapist.
Yeah, I love that. That's awesome. All right, here's my fast five. I think these are five. Favorite concert.
Taylor Swift,
Nice. Favorite Taylor Swift song.
fearless.
All right. All right. Best meal you've ever had.
Ooh. Um, Weirdly enough, I had some pretty good chicken wings down in the Dominican Republic on a service trip. Those
Okay.
like were to die for. Every lunch, the lunch ladies would bring them, and they're fantastic.
Any sauces, any
No,
rubs?
it was just like
Straight up plain chicken
yeah,
wings?
just like how they would cook them, like those. Like you wanted to grab them before because if they were gone for the day.
Oh man.
They were good.
I mean, that sounds amazing. I could go for some chicken wings right now. What does it mean to be a great PT to you?
Just caring for your patient, I think beyond just their physical ailment, but caring for them as a person. Like, because when it comes down to it, we're working with people every day. And if you don't care for who they are, like you're not, you can get the physical side better, but they're going to buy in even more when you care about them as a person.
Great. Mantra for your life.
Ooh, that's a tough one.
Full disclosure, I didn't, Marissa, I just brought her in here and she didn't
Yeah,
have
I
any
did not
time to
have a
plan
prep
these. So
one.
she had no prep.
Um,
Mantra for your life. Any words of wisdom that you live by?
I feel like I had some during like one of our weekly emails, but I that's not coming to me. I feel like just take me for who I am, like just enjoy life. I don't know. I definitely had a really good one there and I can't think of anything right now,
I
but
love that. And what drives you to be great?
I think just enjoying life, like the people who surround me, like definitely push me to be a better person as like a person, but as a PT as well. Um, yeah, those like I have a lot of important people in my life.
Yeah, that's awesome. I love that. Well, thank you, Marissa, for joining me today on the PT's PT podcast. And if anybody wants to reach out to you, I will put your like email in the show notes and
Sounds good.
we'll go from there. So thanks
Glad
again
I
for
could come
joining
on.
us. Yeah.
Thanks.
Awesome. Thanks, Marissa.